Hello, everybody. My name is Michael Avidan. I'm the head of the anesthesiology department at Washington University in St. Louis, and it is my pleasure to be able to talk to you briefly today about some of the priorities that department chairs consider in recruiting residents to our anesthesiology programs. I also want to give the disclaimer that really, I'm speaking mostly for myself because although I could guess that the priorities that are mine apply equally to other departmental chairs, but I can't say that for certainty. So I want to thank the Foundation for Anesthesia Education and Research for giving me the opportunity to speak to you all on this topic. And my presentation will be brief, so hopefully there will be time for questions and discussion. So there are only really three areas that I'm intending to cover. The first is what departments are looking for in residents. The second is tips on how you can think about your career trajectories when you're applying for residency. And the third is some do's and don'ts during the residency match process. So let's get into what we're looking for in residence. The first thing to consider is that really you want to get your foot in the door. You want to get to the interview process. And nowadays, residencies are particularly competitive, and this is true as well of anesthesiology. So for example, if I think about our department last year, we had 1,400 applicants, of whom we interviewed 200. So it's really important that you're able to make a strong impression with your application so that you can get your foot in the door and get an interview. And the way maybe I try to think of a conceptual model to help you to think about that is, let's think about pre-operative assessment. So for pre-operative assessment, which is a process with which you are familiar, you've got both non-modifiable and modifiable factors. So the non-modifiable factors are things that pertain to the patients that they can't really modify prior to their surgery. On the other hand, there are quite a few modifiable factors. And if the patients, in partnership with their clinicians, could change those factors, they would do better in the perioperative period. So similarly, I would like to think about the residency application, the initial application, as being thought of in the same way, that there are factors that you really can't change very much, but there are a whole lot of factors that you can change that will help you to get your foot through the door. So for example, the reputation of the medical school that you're attending, or whether you have a PhD or a master's degree, at the time of your application, those are fixed factors that you can't really change. But I think that there are a whole lot of other factors that you can potentially impact. So for example, your scores on the medical licensure examinations. Well, if you've done reasonably on the USMLE step 1, but you think you can really ace the step 2, it might be worth trying to take that prior to your application. The dean's letter and the transcript, maybe those are relatively fixed, but I think that you can influence those. I think it's very important to think about how those could show you in the best possible light, because certainly programs do take those into account, many programs, when considering whether or not to grant you an interview. I think one of the areas where you can really have a big impact is on the letters of recommendation, because those are with people whom you've worked directly. If you can get a letter of recommendation from somebody who is well known in the field, so somebody who's prominent, who will have name recognition, and if such a person says something like, you are the best student or one of the best students with whom they've ever worked, that sort of letter of recommendation is likely to carry a lot of weight. So if you think about things that can be influenced, think about letters of recommendation. It's very important that you get letter writers who will take the time to write a strong letter on your behalf. In terms of letters of recommendation from chairs, there is a move to standardize these and to hit on specific aspects that programs will be looking at. So that's also probably something useful for you to know as applicants. Then I think you can also consider how you can improve your depth and range of experience. Can you do things that make you stand out? Can you go to summer research programs? Can you get involved in projects that are unusual and that would make you stand out from the crowd? The other key thing is if there's a very specific program you think you would like to go to. So I'll just use our program as an example. Let's say you really wanted to come to Washington University in St. Louis. One could try to get an externship or a rotation at our program, or whether it's a clinical rotation or a research rotation, because I think once you are known by people in a particular program, and if they regard you highly, they're much more likely to consider your application more favorably and certainly to grant you an interview. And then the other thing is there a wow factor about a particular applicant? So, you know, for example, if somebody's worked for the World Health Organization, or somebody's done something that just makes it really remarkable in terms of it's incredibly rare for somebody to have done something like that. So those are just some of the things that you can consider to help you get through the door and get an interview. Then once you have an interview, I will tell you the things, and I've asked various programs around the country, what are they looking for in the applicants? And here is a list that I came up with that I think can be helpful to you in really making yourself impressive in the interview process. And I'm not going to read all of these out. I will go through some of them, but I think we're looking for people who have big picture, who have vision, who have leadership potential and leadership interests, people who are outstanding communicators, people who understand the specialty of anesthesiology and can really convey why it is they want to do anesthesiology. A compelling narrative arc is really useful. And also we're looking for people who are committed to diversity, equity, and inclusion, and are thinking about the broader problems that are facing the society that we are serving. So please think about all of these and how you can tell a story that really showcases your strengths in all of these categories. So thinking about leadership, leadership is really important when we think about anesthesiologists. We want you to be leaders in the healthcare environment, whether it's in the operating room or the intensive care unit, or in the health system more broadly, or in the pain management clinic. We really want leaders, and this is something very important for you to consider. So please think about how you can provide real leadership and how you can convey your commitment to developing as a leader. The other thing that I referred to earlier is we want big picture thinkers. So please don't be parochial in your thinking and consider that anesthesiology research is confined to the small fishbowl where there are only narrow issues around the time of surgery that you can and should be interested in. Not that these areas are not important, but that is not the only issues that we as anesthesiologists should be conducting research into. We shouldn't think that the bigger issues in medicine are in the territory of neurology, psychiatry, surgery, and cardiology. We should be partnering with these other specialties in pursuing big questions that are relevant to society. And actually, I wrote about that when I was the president of the Association for University Anesthesiologists in an article published in the ASA Monitor. And I said we must address scientific questions that matter beyond the parochial interests of our specialty, and that contribute substantially to advancements in health and knowledge. The opportunity is obvious because surgery is one of the leading causes of death in the world today. And this was actually highlighted in an article in The Lancet, which showed that after ischemic heart disease and stroke, surgery is actually the third leading cause, or perioperative deaths are the third leading cause of death in the world today. So when you think about it in those terms, it becomes obvious that we as anesthesiology, which interfaces with patients from neonates through children, through pregnant women, all the way to older adults. So along the lifespan, we have contact with people, and that we should be engaging in all manner of research, and that nothing should be off the table to us. So that's really an important concept. And another way of viewing this is research all across the translational continuum, from the most basic and preclinical research in terms of cell injury, pharmacological sciences, neuroscience, neurobiology, all the way through translation to human, translation to patients, clinical implementation, and healthcare delivery and policy. There are people in anesthesiology who are doing research in all of these translational areas from T0 to T4. And that gives you a real sense of the potential of academic anesthesiology. I also want to emphasize, and this comes from a book by Eric Topol called Deep Medicine, that we're very good at deep phenotyping and deep learning with machine learning these days, but we don't want to lose in medicine our deep empathy and our connection with our patients. And we're looking for that in our residency applicants. Another point that I'd like to suggest to you is that you prepare for behavioral interview questions. For example, if I say to you, tell me about a situation in which you encountered difficulty with a colleague and how you dealt with that situation. There is a technique for behavioral interviews called the STAR technique. Please look that up, but essentially it is a structured way to answer behavioral questions in an interview, where first you describe the situation in which you found yourself, the task that you had to accomplish, and the actions that you took, and what the result was. And then you can also add to that what you learned from that experience. So how can you think about your career trajectory when applying for residency? Well, I think it's very important to think about a program that will enable you to thrive wherever you go. Not a program that's restrictive, but a program that is expansive. Also, anesthesiology is not a specialty confined to the operating room. Anesthesiology is a burgeoning specialty that certainly has a big presence in the operating room and perioperatively, but has a whole lot of other tentacles in health system management, in simulation, in resuscitation, in pain management, in critical care, in telehealth, in perioperative care. There is a lot to anesthesiology, and we want to see that you have that big picture view of anesthesiology. We want you to be totipotent embryonic stem cells. You're going now into anesthesiology, and there are lots of directions that you can take as you differentiate yourselves. You start as being totipotent or pluripotent residents, you become fellows, and then you become experts in various clinical areas or health system leadership areas, in research or in education. There are lots of ways that your career can unfold. I also want to quote the words of Ruth Bader Ginsburg, that women belong in all places where decisions are being made. It shouldn't be that women are the exception. And historically, women have not featured prominently in leadership in anesthesiology, and that must be remedied going forward. I also want to highlight our commitment to diversity, equity, and inclusion. And the motto of any program that you join is that whoever you are and wherever you come from, you are welcome in that anesthesiology department and that program. Because remember, in the words of Maya Angelou, that in diversity, there is strength, and a program that is committed to diversity will be stronger and will train you better for the future where you need to be a leader. So just some do's and don'ts finally during the match process. So be authentic, be enthusiastic, be well prepared, be professional, be yourself, be optimistic, and enjoy yourself. Please don't exaggerate, don't be arrogant, don't be flippant, and don't be argumentative. And these are very simple pointers, but I think they can be very helpful to you. And in conclusion, I'd like to read some of the words from Nelson Mandela, who was a great example to me and to many others. And it's about optimism, and optimism in the face of adversity in his case, where he said, "I'm fundamentally an optimist. Whether that comes from nature or nurture, I cannot say. Part of being optimistic is keeping one's head pointed towards the sun, one's feet moving forward. There were many dark moments when my faith in humanity was sorely tested, but I would not and could not give myself up to despair. That way lies defeat and death." And I use that as inspiration and say to all of you, be optimistic, be enthusiastic. This is such an exciting time for you, and a wonderful residency opportunity lies before you. I very much look forward to seeing you all in residency and in anesthesiology, and wish you everything of the best as you move forward with your brilliant careers.